Hello everyone, I'm Lillee Gelinas, Editor-in-Chief of American Nurse Journal. Today I'm joined by Pam Cipriano, the current President of the International Council of Nurses. Pam is a former President of the American Nurses Association, and she was the inaugural Editor-in-Chief of American Nurse Journal. Today we'll be talking about a very important document for nurses to know about. Welcome, Pam, and introduce us to ICN's new report.
Thank you, Lillee. It's really a pleasure to be with you and to share the release of this new report. Everyone in nursing and healthcare recognizes that there have been serious effects of the pandemic which have decimated the workforce. So everything early on from fear for people's lives, getting infected with the disease, the enormous fatigue, the mental health conditions, everything that we know has lingered throughout the pandemic and may not really be behind us, has had serious effects on the workforce. We've seen mass attrition. We've seen this around the world. We've seen a lot of nurses who don't believe they can return to the nursing workforce. So this report builds on a report that ICN published in January of 2022 called Sustain and Retain in 2022 and Beyond, which really focused on why we need to retain our workforce given what we were seeing at the time of many individuals needing to leave the workforce or feeling like they just could not continue with the pandemic. With that report, even though we believe there's very valuable recommendations and findings, it was really still in the midst of the pandemic when we didn't have good information to understand what were the effects. We already knew there was a global nursing shortage approaching 6 million individuals, but we felt like we needed to keep looking for the data and other evidence that would point us to understanding what have truly been the effects of the pandemic and how do we move forward. So Recover and Rebuild is that next installment of recommendations and really creating the urgency in the nursing and healthcare workforce around the world. It builds on the fact that knowing all of those difficult situations that nurses in particular faced have led to significant burnout. It's not just nurses, but many of our other healthcare partners. At the same time, no workforce has been more adversely affected than nurses. So we're very concerned about making sure that we don't continue to see the levels of burnout that are going to affect the lack of retention and potentially scare people away from becoming part of the nursing workforce. So this report builds on some past intelligence, reviews over 100 studies so that we can take a look at what actually has happened in the more recent years and begin to put into place recommendations that will not only restore and rebuild the workforce, but have that workforce then rebuild our health systems for greater sustainability.
So if I'm hearing you correctly, the key driver for the creation and publication of this report was the need for better data?
Better data that updates us with the effects of the pandemic. Because we know there's always discrepancies in data.
Yeah.
We see that in the United States as well, particularly when we're trying to track nursing shortages. We've always had a mismatch between data from the Health Resources Administration and the Department of Labor, and so we wrestle with that. We know our healthcare organizations don't necessarily have the perfect metric. Is it vacancies? Is it turnover rate? Is it budgeted positions? So we know that getting data about our workforce is challenging. Similarly, when the State of the World's Nursing Report was issued in 2020 as part of what we'd hoped was the International Year of the Nurse and Midwife, we also noted there were difficulties in collecting those data, even though there are extensive efforts to bring that forward. So we wanted to be as current as possible to understand where were we from the beginning of the pandemic to where we are now, tracking the movement of nurses both in country as well as globally to understand what's happening with the projections of nurse shortage, what's happening within our individual workplaces, and again make the case that we need to have accurate data because not having enough health workers means we're not going to have health. We're not going to be able to create the universal health coverage that's needed, and we're not going to attain the Sustainable Development Goals of the United Nations, all of which are targeted for 2030.
So, as you're beginning to talk about the global nursing workforce, can you describe the nursing workforce globally for our viewers?
Yes, absolutely. We may not be aware of how fortunate the United States is, but we have more nurses per population than most countries, almost every other country. But when we look at the shortage around the world, as I mentioned, pre-pandemic it was projected just under 6 million. That number's been increased to at least 7 million now. But half of those shortages are focused in African nations, and many of the others are in low to low middle income countries. That the wealthier nations tend to have more nurses and healthcare workers in general. And so when we look at the shortage, we're looking at gross numbers, but when we look under the hood, what we find, and this is important for how we look at shortage in the United States, facility by facility, geographic maldistribution, all of those things considered, is that we try to understand the workload of the nurse. And so while nurses in the United States have been focused on trying to look at hospital staffing and the amount of patients that a nurse can normally take care of, or that our data has suggested in a number of studies that 4 patients to nurse is ideal, and that more than that, depending on the circumstances and the acuity of the patient, could lead to worse care, higher mortality. In other countries, the nurse-patient ratio could be 1 nurse to 30 patients, and it may have gotten much worse during the pandemic. So when we say shortage, it takes on different meanings in different places. But again, recognizing that there are many countries that have absolute shortages. They are in much worse condition than the United States. There's also a really interesting paradox in a number of countries that I would want nurses in the United States to appreciate, which is in many countries that manage their healthcare systems, they also decide how many nursing positions that country has. So when the positions are not funded, there may be what they're reporting as a shortage of nurses, but in reality, it's a shortage of funded nursing positions. Some of those very same countries have unemployed nurses, as well as unemployed physicians and pharmacists and paramedics and other healthcare professionals. So understanding the data, understanding the country level picture and what the officials are putting forward can tell a very different story. So that's why we really want to understand globally what's happening with the workforce. How can we have systematic data collected and reported so that we understand what's happening? Because even though we tend to think about nursing as a local workforce, we know it also operates at a national level and now a global level as borders are blurred and international recruitment has taken on a significant role in what's happening with nurse staffing around the world.
Oh, for sure. So as you're describing the global nursing workforce and the nursing shortage overall, from the global perspective, Pam, how is the nursing shortage itself viewed in the United States versus how the nursing shortage is viewed in other countries?
I think in the United States we finally have accepted that our nursing shortage is a shortage of nurses who are willing to work in hospitals in the current conditions that they are confronted with. So we know we have a lot of nurses, and yet we see every day more and more reports about delaying care, curtailing services, inability to fill positions, closing beds, not being able to operate nursing homes at capacity. So we know that there are a number of settings where there clearly are not enough nurses. At the same time, we have nurses working in many, many different roles and industries that it is wonderful to have that input and insight. So our shortage in the United States is a maldistribution of setting with hospitals, and then there's also some rural and urban issues in terms of where nurses can work. Globally, it is much more focused on the shortage of positions, as I mentioned, in terms of how many positions is the government funding or allowing to be paid for, as well as significant differences between urban and rural settings. The smaller the country, sometimes the more drastic the shortage could be, because even losing, a few percentage points of your nursing workforce could be, very devastating. And so we're very sensitive to understanding, how a shortage affects those countries because, I have to recognize that, again, international recruitment is a major issue right now. And more often, low-income and low to middle-income countries that are reporting shortages and reporting out migration of their nurses are saying the people that are leaving are their experienced nurses. So think about, how that relates to us in the United States. We are very concerned that many of our older and more experienced nurses have left the hospital setting, either because they couldn't keep up with the work or left during the pandemic, or just the natural exodus from the workforce at certain ages. In other countries, though, that brain trust is leaving, so people want to find better employment, better pay, those kinds of things. But in the vast majority of countries around the world, they are struggling with the same issues of adequate pay, of a supportive nursing work environment, of making sure there's no violence, that there's no sexual harassment. So these vast issues affect every labor market and every place that nurses practice. It is the numbers, though, that make the issue more critical in some places than others.
Well, the report sure spoke to, excuse me, the report sure spoke to me about how the pandemic just devastated the workforce worldwide. The report also has an action plan. It's very action-oriented as to what we need to do. And I was struck by just definitions. You talk about the importance of not only gathering data, but gathering the right data. So in the report are suggested definitions that all of us, no matter what our country is, should be using. Is that right? So we all use the same definition of nurse turnover or nurse vacancy. What is this definitional issue that we do need to address across the globe?
It's going to be really important to have consistent data. And unless you have data definitions and vocabularies that are similar, then it's, as we say, apples to oranges, as opposed to really being able to compare country to country. And the World Health Organization database tries to do some of that. And again, it's because so much of the data are voluntarily reported, we have to go back and question the rigor with some of those reports. But we are really advocating that there be very consistent definitions. And actually, one of the starting places, too, is who is a nurse. And you would think that's an easy question. It is not, because we know that in different places, different levels of accreditation, licensure, no licensure, number of years of education, whether that job is a protected category, whether it's defined in law or not, tends to be a challenge. And so we try our best to define nurse based on a formal education and a set of activities that kind of mirror a general sense of what a nurse does. In the State of the World's Nursing, what we found was that the average span of nursing education was anywhere from 3 to 5 years around the world. So we try to come together on that definition. But again, turnover, vacancy, making sure that we're looking at those rates as common numbers is really important.
It sure is. And finally, Pam, the report is, like I said, an action plan for the international level, at the national level, the country level, but also at an individual level. So what do I, as a nurse, take away from this particular report? What do I need to do? Why is it important for me as a nurse to read this report and understand its contents?
ICN typically does issue recommendations at every level because almost every issue that is important to us in the delivery of health care is a systematic issue. So it means that interventions are needed at all levels. It doesn't rest only on the individual. However, individuals are part of the solution. So we know that it's important for nurses to speak up. We know it's important for nurses to influence the environment that they practice in, to command control of practice, to be able to identify the needs that are occurring both in terms of numbers of individuals as well as defining the roles of nurses and any other personnel that are assisting, again, regardless of of the practice area, and also to make sure that if there is the opportunity to cooperate and collaborate in the submission of data, that is occurring as well. And also, again, with the spotlight raised on mental health and prevention of burnout, to be able to look for those solutions with their employers, with their governments, with their communities, because we see nurses as one of the most precious commodities, if you will, in our workforce. I mean, without nurses, there is no health workforce. And without a workforce, there is no health. So we want nurses as individuals to read all of the recommendations so that they can speak to the other leaders in their organizations, in their countries, in the associations that they're part of, in order to be able to move public policy decisions that support nurses. They can be active in making sure that there aren't laws restricting their practice. I mean, that's a big issue, not only at the advanced practice level, but at the generalist level. We want to make sure that those nurses are advocating, again, for policies that keep them safe. That we learned in the pandemic, front and center. So we want nurses to be spokespersons and active advocates that are asserting the needs of nurses and the needs for the workforce. Ultimately, that's what nurses do because they're advocating for their patients. This is not self-centered. This is saying we need this for nursing because that's what we need to be able to take care of patients. That's what we need to be able to do to create health for all.
So I'm taking away a key headline that you said: without a healthcare workforce, there is no healthcare. Thank you, Pam, for your leadership, leading us globally as a nursing community. And thank you for explaining a very important report to all of us nurses, but to healthcare in general.
Thank you.